Okay, we will go ahead and get rolling this afternoon because I know it is a quick half hour and I want to make sure that we make the most of this time together. My name is Christine Snyder and I'm the Senior Director of Solutions Engineering here at SanData. The Solutions Engineering Department, it may sound a little bit different, but we focus on working a little more behind the scenes with on the technical side of things, working with clients and our engineering team to make sure that our solutions are successfully delivered and maintained. Today's topic of webinar will be population health and social determinants of health. And the key objectives for today will be to review key concepts regarding social determinants of health and population health management, to discuss SDOH, as social determinants of health are known, and PHM, population health management, in HCBS, home and community-based services, through the lens of Healthy People 2030 and other state and MCO programs, and to provide insights into short and long-term actions you can take to apply these concepts in HCBS. So we'll start with a quick review of population health and population health management. Now, population health is a concept that's been around for a couple centuries at least. It's not new. But the term most notably came into the light when David Kindig and Greg Stoddart proposed an official definition for this term back in 2003 rather. And that's what you see on the slide here. They proposed the definition for population health be that population health is the health outcome of a group of individuals, including the distribution of such outcomes within the group. That's a pretty succinct one sentence definition. If you were to ask yourself to define population health, or if you were to ask colleagues around you, you'll probably get some different definitions that come about. It seems that there are different meanings to each individual, depending on whether you are a provider, an individual who's recently received care, a caregiver, or an individual going through a health system. Your definition may be a little bit different. But whoever defines population health is probably going to have some of the key factors that you see listed out here that both Kindig and Stoddart argued the field includes, and that is health outcomes. So that's both measuring and tracking to improve health outcomes. Patterns of health determinants, and that determinants word is going to be a key one for us today, and the policies and interventions that link the two. They argued that the field includes these items. And if you take a look at the definition of population health management, you're going to see that it is the technical field that works to achieve population health, incorporating these factors and a variety of interventions in order to improve the overall health of a population of people. Now, if you were to take a look at a health system, a city, a region who was focusing on population health management, you would see that their playbook to focus on this is probably going to include establishing detailed patient databases. So lots of information. The more information that you can get regarding how a person's care has gone, what's going on in their lives, how they feel and what they think and what their opinions are regarding care, the better, and making sure that you are focusing on the full person in order to put policies and interventions in place and achieve better health outcomes, along with determining what to measure for success. Patient education, communication, and engagement is probably going to be key tenets of that playbook as well. Care coordination, and tracking and measuring outcomes. And in fact, if you look at the graphic on the right-hand side of the screen, it's intended to kind of pull together what this all means, and that every person, no matter who you are, provider, payer, an individual receiving care, you have a part to play in this population health management wherever it happens, out in the community, an acute setting, post-acute setting with skilled nursing facility, rehab, in the home, or even just as an individual, a healthy individual living their day-to-day life. Now, we're reviewing this today for two main reasons, and it very well may be stating the obvious, but number one, we are all part of this population health management model, whether one of those parties that I just mentioned. And so we all have a vested interest in the strategies and interventions that help manage it. And it takes information, coordination, and cooperation in sharing information and insights in order to manage this effectively. And also health determinants, that second item that Kindig and Stoddart mentioned there as a key portion of population health management. It's a key word that we're going to talk further about today. Specifically, social determinants of health. They play a key role in population health management. So we're going to switch our focus over to that for just a moment. And from this point forward, we'll refer to social determinants of health as SDOH, just to save a little bit on time. But the Dahlgren-Whitehead model of the main determinants of health was first created and published almost 30 years ago exactly. So as of 2021, it was 30 years ago in 1991. They determined that an individual's health was based on that individual's lifestyle and the factors within that individual's lifestyle, their social and community networks, and general socioeconomical, cultural, and environmental conditions. And together, these factors have been broken into the 5 domains of SDOH that you see listed on this slide. And that includes education, access, and quality, healthcare access and quality, neighborhood and built environment, social and community context, and economic stability. And it's been determined over the years that SDOH are about 50% of the determining factors in a person's overall health, which is why they're such a big part of population health management, but also why there's such a big focus in healthcare today. And you hear so much about SDOH. And these 5 domains and this overall um, representation of SDOH are what's been agreed upon by many renowned and guiding organizations, including the World Health Organization, Centers for Disease Control, and the Centers for Medicaid and Medicare Services, which we're probably all familiar with those organizations, but most especially CMS. Also, the US Department of Health and Human Services, they have also recognized these as the key domains for SDOH. And along with the Office of Disease Prevention and Health Promotion, they've even included them in their Healthy People 2030 initiative. Now, this is a national initiative. It's actually a follow-up to Healthy People 2020. And what it is it's a program or initiative that sets data-driven national objectives to improve the health and well-being over the next decade for all people within the United States. And this Healthy People 2030 initiative includes 5 overarching goals, but there's a few of those included here that I'm going to call out and mention, and that's health equity, health literacy, and focusing on social determinants of health. That is actually a specific focus that they have put into this Healthy People 2030 initiative. And that is because the way that the US Department of Health and Human Services and the Office of Disease Prevention see it, SDOH contribute to health disparities and inequities and promoting healthy choices. If you were just to go out into the community and you were to say, well, make a better choice and here's what it is, that alone is not going to cut it. It's going to take public health organizations and partners such as education institutions, transportation, housing, to take action and improve conditions in environments. And that's why they have actually made SDOH an increased and an overarching focus in Healthy People 2030, even more so than Healthy People 2020. So if we take a little bit of a closer look at Healthy People 2030, I want to break down through the lens of SDOH how this all applies to HCBS. Because this is a national initiative, it may not be something that comes up very much in the home and community-based services space, but as part of population health management, it may very well be something that you've heard of before. But in Healthy People 2030, there are different areas of focus or categories of objectives, rather. Some of those categories are listed on this slide. Of course, there are many, many more categories of objectives, and some of those objectives are broken down to focus on specific population of people, whether that's certain age groups, children, older adults, what have you. Um, but I picked out these particular categories and their objectives for a reason, because I think they all relate to home and community-based services. And the data that is captured through home and community-based services day-to-day interactions with providers, with caregivers, I think all could have a part to play in that. For instance, if you take a look at healthcare, two of the objectives underneath that section are to increase the proportion of adults with depression who get treatment. And I've included the actual ID of the objective here in case you wanted to go and take a look at it. And I should also mention that every objective that's included in Healthy People 2030, it has a measurement of how much data the U.S. Department of Health and Human Services has been able to capture around that objective. Um, and then depending on how much data, if there are documented interventions that could be tried if somebody were to focus on that particular objective, and the information that is gathered together, the data being reviewed, the interventions proposed, all of these are focused on by more than a dozen work groups, which include subject matter experts with different backgrounds and area of expertise, but they are all SMEs in that particular area and contribute to the development of those objectives. So that means that number one, with this objective, we need to capture data around it, right? We need to know how many adults have depression and how many of those adults are actually getting treatment. And the objective, of course, is to increase the proportion of adults with depression who get treatment. Well, in day-to-day interactions with individuals who are receiving home and community-based services, there's an opportunity to ask them, hey, how are you feeling today? Are you feeling down, depressed, hopeless? You feeling good? But if for some reason you're not feeling great or you're experiencing feelings of depression, how often is that happening? There are several questions that can be asked at that point of care to get to capturing information of, okay, who has depression? And then could even be an intervention at the point of care of suggesting some resources or taking a next step to encourage that person toward seeking help for that. Another objective under healthcare is reduce the proportion of people who can't get the dental care they need when they need it. Well, individuals who receive care at home or out in the community, they're still able to talk to providers and individuals who could ask a question of, hey, how is everything going? When's the last time that you were able to see a dentist? Are there any challenges that you have to that, whether it be transportation or even just knowledge of providers in the area? Anytime you have that interaction with somebody, there's an opportunity to be asking those questions. In the parents and caregiver space, there's an objective to reduce anxiety and depression in family caregivers of people with disabilities. Several of the payer programs that we work with have caregivers who are family members providing care to their loved ones. So there's an opportunity there to ask them directly as maybe they're documenting their electronic visit through EVV. Hey, how's everything going for you? Are you experiencing any particular struggles? Is there anything that you need assistance with? It could be a freeform capture. You have the capability and the tools in place through things that you may already be using, like EVV, to explore capturing information in these areas. And then there's health communication. Two of the objectives here are reduce the proportion of people who can't get the dental care they need when they need it, and decreasing the proportion of adults who report poor communication with their healthcare provider. And we're just talking about communication here. You may not be a dental care provider. In fact, chances are that you are not, or that it is part of your space or programs that you work within. But again, if you have somebody in front of an individual able to ask questions, able to talk through other parts of their lives. If you go into a person's home, if you are assisting them with services out in the community, there's a very personal interaction there that goes along with that, where you can have the types of conversations that cross those different areas and domains in order to increase and capture of information to see how we're doing as a nation in these areas, that Healthy People 2030 initiative, but also potentially be at a point where you could provide interventions for that as well, or suggestions for next steps. Now, Healthy People 2030 is a national program, but there are, of course, other SDOH-based state or MCO programs that are out there. So this is a focus for everyone, including at a state and MCO base. And these are just some programs that are out there and available in order to help improve population health management, PHM, by focusing on SDOH, like the Katie Beckett program, for instance. Now, this has been enacted in some form in at least 24 states, but it provides an alternative for many individuals under the age of 19 who have serious conditions related to their disabilities, but which might cause them to be placed in an institutional setting, but the Katie Beckett waiver allows them to receive care at home. So that's focusing on the individual and their outcome by focusing on where they receive care, what the best is for that individual, and providing a way for it to be received at home. There's the Supplemental Nutritional Assistance Program, or SNAP, which helps to focus on the health and well-being of an individual from the standpoint of the nutrition that they receive and how that fuels their overall health and well-being. There's housing engagement and support services, which focus on helping people who are homeless, for instance, or this is a type of program that could focus on helping people who are homeless and might be eligible for home and community-based services get connected with somebody who could help them find housing, retain that housing, see what their housing needs are. And then there's in-home therapy services. Now, this might not be one that is commonly thought of as an SDOH program, but if an individual is able to receive therapy within their home, instead of having to go out to a provider location and receive it, it is allowing them to overcome transportation issues, potentially, maybe overcoming anxiety with going out in public if that's something they struggle with. It is a focus on SDOH to help ensure that that person receives the best care they can and achieves overall well-being. And then, of course, there's care coordination programs. This is a huge initiative, and it's one that MCOs in particular are enabled and very capable of fulfilling, but connecting case managers with individuals who maybe need connection to resources and figuring out where in their community they can go, or providing health education and literacy. That's one of those goals for Healthy People 2030 is health education and literacy. But helping an individual navigate across that continuum of care, checking in with people, making sure that they are achieving the best outcomes where they are with their health. So that's why you'll see on this slide, there's population health management, and rolling up to that is Healthy People 2030. So there's national initiatives or programs. There are state programs and initiatives. There's initiatives and programs through MCOs, and then there's your own organization. Maybe you are in an organization that is already focusing on plans and measurements to make sure that you're focusing on SDOH and meeting people where they are, considering the whole person in order to improve health. All of those are taken into account and they relate to SDOH. Now, when we talk about those national initiatives or when you talk about those state initiatives, there are some key pieces of data that are captured that roll up into that, specifically age. So there are several of the Healthy People 2030 objectives that specify the population of people they're looking for is adults 65 and over or adults 18 and older. So knowing a person's age, their race and ethnicity, their gender, their marital status, their address, where they are geographically, their transportation needs and status, whether or not they have access to nutrition or their overall nutritional status, their understanding of care and services provided. These are just a couple data elements, but things that providers could be capturing on a routine basis, state and MCO programs may be capturing on a regular basis, but having this baseline of data all helps contribute to knowing whether or not there's an SDOH program that needs to be created, one that is being supported and validated, or one that needs adjustments within that population health management. So, okay, so what? So what about SDOH and population health management? Well, no matter who you are, a provider, a payer, there are some short-term actions that you can take if you want to focus on SDOH within your space and improvement of health outcomes using it. And those are first to prepare your stakeholders. There could be a lot of pushback from individuals if you were to go in front of them and start asking questions about who they are and their health and well-being status without a lot of background, or without having the conversation about how powerful gathering that information and their input can be. So that's one of the first short-term actions, is prepare stakeholders and think about what tools, aids, or personnel might be best to assist with that conversation with your stakeholders. The second action is to assess your current state. So what data are you currently capturing? And we talk about this with our clients here at SanData sometimes as well, quite frequently, more than sometimes. We take a look at the data that's available to be captured, maybe through SanData systems or other programs that they're using, and then what they're actually capturing, because you may have a capability that you're not aware of making the most of. So it's good to also take a look at your compliance rate for the data you're capturing. You might have the capability to capture data. It might be out there and in front of people, but you're only getting the data half the time. So you'd want to take a look at what your compliance rate is, what additional data you could be capturing, and how you could improve compliance. So if there are struggles with getting the information that you need in order to support to, contribute to these initiatives, your own initiatives, your state initiatives, um, then it's good to take a look at, okay, why? What's the root cause? What's the reason why we may not be getting that information that we need, and what needs to happen? And then determine your goals. So what do you want or need to know? Ultimately, what's the big question about the people that you work with and you serve across the care continuum? What is it that you need or want to know? And who would be the most beneficial to be able to share and exchange information with? That's also a key one, because maybe you have a piece of the puzzle or some information, and you know of another entity that you work with or you would like to work with who has more information. Having that conversation internally and determining who it is that you would like to be able to work with is key in a short-term action to one of the long-term actions we're going to talk about next. And then what do you want to be able to do with that data? So once you have it, ultimately, what's the end game in mind? And that also relates to that what do you want or need to know question. And that leads into the long-term actions, because just fulfilling those first three things, that can take time. It's not something that happens overnight. We realize that. So from a long term, the first thing is to form an action plan. What data points do you need to capture to meet your goals? What is the follow-up process that will occur once you have all of the data? So let's say you got all the data you want. One of the key pieces that we see is sometimes missing from that action plan is, okay, now what? Who needs it? Who specifically within your organization, your program, what have you, who needs it? How often do they need it? What are they going to do with it? Do they have the access they need to get it and to take that next step? That's all a key part of that action plan. And then also, how will you capture the data? Once you've done your current state assessment, maybe where you originally thought would be best to capture the data isn't the best anymore. So now when you're forming your action plan is the time to determine how you will capture that data. The second long-term action to take is work with your vendors. So what could be added to electronic systems to capture needed data? And this isn't a long-term action bucket because it may not be a quick process. There might be some lengthy discussions on within that electronic system, which there could be different pieces and parts and who uses it, of discussing where it would go, how it would function, how it would be achieved. Another question to consider under that work with vendors is what information is already being captured that could be leveraged towards goals and plan. So maybe you need data. You're not currently capturing that data, but somebody else is. So across your organization systems, if somebody else is already capturing that, maybe it's just a sharing of information that could be leveraged in a cooperative state. Also, what data can be connected or shared between systems? So actually, that's a little bit of a duplicate, but uh, same thing, determining what data can be shared or connected between systems to get better insights. And then once you have set the groundwork with the individuals that you will be asking information from, determining where you are, figuring out where you want to go, putting an action plan in place and working with your vendors to execute it, then is the time when you can capture that data and take a look at what it's telling you and then follow up, execute on that follow-up plan for the data, whether that's in care coordination or sharing it with partners or just taking a look at trends overall or contributing to a larger state or national initiative. You can capture that data and act. So I know that was a lot here in about 25 minutes, but we do want to go ahead and open this up for questions at this time. I do want to go ahead and mention that later in February, by the way, this last action step where when it says capture data and act, once you have that data, there is so much power available to you from a data analytics standpoint, depending on potentially the platform that you're using and the tools at your disposal for data analytics. But there's a lot that data can tell you. And later on here in coming weeks, then just the next month, we will have our VP of Data Analytics here at SanData, Carrot Pandit, talking more about the capabilities of data analytics. So they tie very closely together. Wanted to make sure and mention that. But let's go ahead and take a look at the Q&A box at this time. So if you do have a question, I'd like to go ahead and encourage you to put that in the question and answer box. And we will be taking a look at those and answering those live on the call here. We have a couple minutes left here in the webinar, and we'll see what questions may come in. Oh, the question is, the interdisciplinary system can be very overwhelming. Do you have advice on where to start? Um, and yes, but that also depends on which interdisciplinary system you are working within. So is that within a health system, a state system, a national system? And maybe your question encompasses all of them, which would also make sense. And the advice that I give is there are a lot of resources out there that I didn't even realize, really, that help provide some insight into what's going on at a national level, a state level, and even within your community. I hate to say it, but the internet's a big one. But there are also communities, like there's the US Department of Health and Human Services. Your state has a Department of Health and Human Services. And then locally, you may even also have an organization whose primary objective it is, or one of their day-to-day roles is to keep track of what are we focusing on and what do we need and what are we trying to focus on helping both from a provider standpoint and an individual standpoint. So I would recommend reaching out to those either national, state, or local levels. Starting small can be most helpful, especially if you are a provider, in finding out what is your community focusing on. For instance, I live in the state of New York. I live in Buffalo, and I know that something that the state of New York is focusing on are implementing new things within schools, a laundry room, a food pantry, right within a school organization, possibly even connecting a little health clinic there as well. That's something I never would have thought of, but if you as a provider want to learn more about that and maybe connect into that, getting in contact with the state of New York, I think is the only way I would ever learn that. It's a local newspaper where I learned that from. So that's where I would recommend starting. Oh, and in fact, our next question was what programs are currently active in New York that home care agency can participate? Importantly, what programs cover the cost of such activity? And you know what, that is a lot more in-depth of an answer, but that is something that we'd be more than happy to reach out and talk with you more about. At this time, we are at 1:31 p.m. and we do want to be respectful of everyone's time, but thank you so much for taking time out of your day to join us for today's webinar, and we hope to see you on a future webinar soon. Thanks and have a great day.